Hi guys, welcome back to the channel. This is Phil and Emily. I'm the occupational therapist and she is
the physical therapist.
All right, so today we got a good one for you. We'll be talking about neck pain. All right, so let's get right into it, guys. So neck pain. So at some point, everybody experience that, and there's many ways that you could, have neck pain, and there's many factors such as, your posture, the way you sleep. It could also be arthritis or just stiffness, or the way you set up your desk at work. So there's a lot of different factors.
I think one of the biggest culprits overall for people is really how they sleep and how many pillows you sleep with too.
Right.
Because too many pillows are going to cause you to be in too much flexion throughout the night. Also, if you sleep on your stomach and you have your head turned, rotated to one side or the other for the entire night, then it will cause obvious pain. That's when you wake up and you have stiffness, pain in the neck. It can also radiate down into the shoulder.
Right, and that's why I sleep with a very flat pillow, like a pancake. That's the way I like it.
You want to keep your neck in as most neutral alignment as possible.
Right, and if you do have neck pain, that could be a symptom that happens, overnight. If you, like Emily said, if you sleep, the wrong way or for an extended period of time in that same position, but that could be something that builds over time. So today we're gonna show you a couple of different exercises that you could do to make sure that you strengthen the neck muscles, but also focus on your posture, and also some stretches and stretches that you could do that could relieve the pain right away.
One of the things with your posture, we're all hunched over, we're over our phones, our tablets, whatever all the different things that we use. And so the front muscles tighten up, your head is forward, and that causes a muscle imbalance. And actually over time, it can cause neck pain. So even, when you're driving, you may be slumped, your shoulders are rounded forward. So one thing that I try to do just at stoplights and stop signs is trying to squeeze my shoulder blades back and together and bringing my shoulders down. You don't want to bring them up to your ears, but bring them down, keeping the back of your head against the back of the seat.
All right, so let's start with some gentle exercises. Let's say that you have neck pain and you just want to stretch the neck gently. So let's start by doing a very simple one. You don't need any equipment at first. But what you want to do is sit up straight in the chair and make sure that your shoulders are relaxed. Try not to hike up your shoulders like this. So keep them relaxed, and if you want, you could kind of hold the side of the chair with your hand and then gently just drop your neck to the side. Make sure it's straight down, like your ears is going down to your shoulder, and try not to go up with the shoulder. Keep it down. That's the reason that you're holding the side of your chair. If you want, you could even add a little bit more into it by gently pulling your neck down this way. There's another one that you could do. You could kind of change the angle. Instead of going straight down, you're just gonna look at the 45-degree angle and then pull down like you're looking at your opposite knee and pulling it down and stretching it, and do the same thing on the other side, of course. You could also try to roll the shoulders back just to relax those muscles back this way. And if for some reason you wake up and we all have that at some point in our lives, that you feel like your neck is stiff, you can't turn it, you can't go up or down, and it's very painful. One way that you could relieve the pain very quickly is by getting a small towel like this. You roll it up, you place it behind the neck like this, you hold it, you make sure your head is straight, and you push straight back against it, trying to relieve the pressure and trying to manage some of that pain. And the next one, with rotation, that's one of the things, because you could see people going like this, turning their whole body because the neck is so stiff and painful. So what you can do, you're gonna hold the towel with the opposite hand, and you're gonna try to use the towel to assist you to go into that rotation, so you can really give it a good stretch. Then you kind of hold it there a couple seconds, then you come back, you do the same thing on the opposite side. Rotate, make sure that your head is straight, not go down, make sure it's straight, just go into full rotation.
And make sure you're taking nice deep breaths during all the stretches, and you want to hold them for 20 to 30 seconds.
Right.
Which is actually a lot longer than we think if you actually watch a clock. So just make sure that you're not holding it for only a few seconds, because then you're not really getting an adequate stretch in the muscle.
Right. So now exercises that you could do to make sure to prevent this to happen, you know, in the future, to build your strength and your neck muscles. So what you want to do is a simple, very gentle exercise called the chin tuck. So what you do, you keep looking straight forward, and it's like you're pushing your chin back. It's like you're getting that double neck.
chin.
Yeah, double chin.
You don't want to look back or down. That's why
Push
putting
back.
your fingers there so that you go
Gently.
straight back. And like Phil said, I always tell my patients too. So it's like you're trying to give yourself a double chin, which we're always all trying to avoid.
Another thing that you could do is, this is isometric contraction. It means that you contracting the muscles, but there's no movement of the joint. It builds up that support and stabilize the muscles of the neck, and also between the vertebrae and the spine. So what you do, you could kind of hold your head with one hand, and then you try to gently push against to the side. So the motion would be like this. But since it's isometric, you try to do it, but there's no movement. And don't go too hard on this one, guys. Maybe just a little bit, like 30-40% of your strength. Don't just try to really push, then you're gonna strain yourself even more, and it's gonna be even more painful. So you do the same thing again on the other side. You do a couple, 2 sets of 10 or something like that. Not too many. You could also do the same thing by sitting on your couch, placing a towel behind your head, or if you have a very fluffy one, you could just push slightly against, relax, push again, and relax. It's a little bit like chin tuck that we just did. Don't go all the way back this way, but try to push straight back, and hold it 2-3 seconds, and then do it again. Again, not too many times, just a couple of times to strengthen those muscles.
Also, something that can cause pain is if you're carrying a purse or a bag that's really heavy and you always carry it on one side. It creates an uneven strain on your muscles. So if you're in and out of your car, women, if you have a really heavy pocketbook or purse that you always hold on your dominant side, trying to lighten up that load too will decrease the strain on things. And also now, if you have a work bag that is very heavy, getting one that has wheels that you can pull, different things like that can help decrease the strain just on everyday things that will help decrease you getting neck pain in the future.
Right. And also, guys, if it's something more severe, if you feel like you have some radiation down the arms and things like that, or numbness, tingling, things like that, then it's probably something more severe. You might want to consult with your doctor or your physical therapist. They can provide more treatment. Alright, guys, so thank you again for watching us through the channel. If you have any questions, just leave it in the comments down below. Don't forget to subscribe. Also, give us a like. That would really, help us with the channel. And let us know if there's anything else you want us to address for the next one.
All right, guys, have a great day.
All right, guys, so stay active, stay healthy, and we'll see you in the next one. Bye.
Bye.